Good morning, everyone, and welcome to Rothkopf Law Group's first virtual panel discussion. We're so happy that you're here with us today as we kick this off. My name is Linda Coppinger, for those of you who don't know me. I'm the Special Projects Coordinator for the Rothkopf Law Group, and we're thrilled that you're all joining us to see this panel, COVID-19 Pandemic Update, a look back, and the road ahead. Now, co-facilitating with me today is the New Jersey Director of Community Relations, Laura Nelson. She's been, as we refer to her, the person behind the curtains. She is one of the gurus of Rothkopf Law Group's virtual undertakings these days. And she's helped tremendously with getting our slides ready and making sure everything's going smoothly. And Laura, I'm going to kick it over to you so that you can share everybody some tips on how this day is going to go.
Great, thank you, Linda. Hello, everybody. I am just going to go over, for those in the audience that are new to GoToWebinar, some tips on how to engage with the panelists. So what you will see on your screen right now is a slide that shows some of the control buttons. The audience will remain muted the entire time. That is to help with background noise. So if anybody would like to ask any questions, and we do invite questions to be asked, please find the chat button or the questions in chat, and you can go ahead and enter any questions that you might have for the panelists in that section. We are not going to be taking live questions because we have a rather large audience. So what we are going to do is we have a time at the end of the panel to bring up a certain amount of questions to answer. In addition to that, if you're having audio issues, if you're having difficulty hearing me, please click the audio box and you will see a choice to switch from your computer audio to your phone audio. If you have any questions about how to do that, please go ahead and enter those questions in the question box and we can field those questions offline. Lastly, you can expand and minimize your screen. We're not monitoring if you're staying live on the screen. If you're just listening in, you can open it and close it by touching that little orange arrow. And with no further ado, I will pass this back to Linda.
Thanks, Laura. And as many of you know, today is the day that we were supposed to be meeting in person at the Westin in Mount Laurel for our third annual Symposium for Elder Care Professionals. But unfortunately, because of the corona pandemic, we needed to find another way to get together. All of us in these days are struggling to find ways to connect and discover how to help those we serve during this pandemic. And Rothkopf Law Group has been challenged just right along with you. So we needed to rethink how we could deliver information and have found that the virtual platform has been a great connector. We've already had some great success with our weekly meetings of the minds and online education courses. So we felt that this virtual panel was going to be the next logical step. And we're so happy that you're here with us today. But despite this different format, we're going to make sure that you have an opportunity to learn something new and gain new perspectives. As you'll see from our schedule on the screen, our schedule is packed today. So we promise to make good use of your time. And Laura said you can be entering questions for the Q&A as we go along. And she and the people behind the scenes will take care of that. But before we kick it off, I'd be remiss if I didn't do a shout out to the sponsors and the exhibitors who had committed to get involved in our symposium that was supposed to go today. And they have been so supportive before this and during this crisis. So you'll see on your screen, these are the sponsors for the symposium, and we want to give them a huge thank you. Thank you very much. We appreciate all that you've done for us. Now, I'm sure all of us know how dramatic the impact of the coronavirus has been. It's been unprecedented. and it's been no more drastic than on our seniors. So we're wondering, how can those of us work with our elders deal with this? So to get an idea of how our facilities and businesses are coping, we've assembled a panel of experts who will share their perspectives, their challenges, and their successes with us today. You'll get to meet all of them shortly. There's a shot of them on the screen. But before you do, I'd like to turn things over to Gerald E. Rothkopf. Jerry is the founder and managing attorney of the Rothkopf Law Group, and he's the reason we're all here today. And we so appreciate the commitment and dedication to the elder population that he has. I'll give Jerry an opportunity to introduce himself, and he's going to give you a brief overview of the firm and its response to the COVID-19 crisis. Jerry, take it away.
Thank you, Linda, and thank everyone for attending today. My name is Jerry Rothkopf. I'm managing attorney of Rothkopf Law Group, an elder care law firm working in both Pennsylvania and New Jersey. So thank you to all the sponsors, as Linda said, and thank you for everyone for participating, and specifically the panelists. The goal today is give you an update on where we started during the COVID-19 crisis in early March, and where we are today, and then where we are going, and what will the future bring. And we have an esteemed panel. And so what we're doing as a law firm is we had to reinvent ourselves. Like many businesses, and then we'll talk about the issues related to the business side. Certainly, we are in the people business. We are used to interactions with between staff, between our clients and their loved ones, of course. And we had to reinvent ourselves because that doesn't exist at the moment, and it's not easy. I have some good news though. I don't know if, well, at least for those in the Philadelphia, South Jersey area, it's miserable today. So what a better way to spend the next hour and a half, 2 hours than on this webinar. Who wants to go outside today? So April 30th would have been our symposium in Mount Laurel. It was already stated, and it's supposed to pour all afternoon. So who wants to schlep their stuff back and forth? We can all be inside. So there is a bright side to everything. That it's supposed to be a rainy, windy day. So may as well learn and share ideas together. So thank you once again for participating. As many of you know, our keynote speaker was scheduled to be Dr. Josh Luke. Instead of the keynote, at the outset, I'd like to show you a video that our keynote speaker, Dr. Luke, has put together to discuss what will be forthcoming, a little bit about what we're talking about today, and then what we have to look forward to when our symposium certainly occurs later on in the year. So Linda, may you show the video?
Laura?
Hey folks, it's Dr. Josh Luke here, and I'm so excited to be your keynote speaker for this year's Rothkopf Law Group Symposium. I'm disappointed, as many of you are, as it's not going to be at the end of April as we'd planned, but going to be in October now. So hey, if you haven't signed up yet, let's go ahead and sign up for either date. If you haven't saved the date and you were originally going to go to the April 30th event in Mount Laurel, the date is now October 8th. So we'll be in Mount Laurel on October 8th. We will be in southeastern Pennsylvania on October 22nd. And guys, there's a new normal for nursing homes, right? So it's time for us to stop and go, whoa, what's going to change in a post-pandemic environment where infection control is now even more of a priority? You better expect that the federal and state governments are going to be ramping up those infection control protocols even more than ever. And what I want you all to think about for the nursing homes that you work at and represent is this. Are they prepared to sustain the elevated level of infection control protocol that they have grown used to during this pandemic, because it's going to be required. So I really think the theme of the keynote titled The Health System of the Future, okay, and the health system of the future includes the nursing home, skilled nursing and assisted living, But here's the deal. The new normal in the health system of the future is an elevated level of infection control, even beyond what it's been for the last few years. We're going to cover that in depth in the health system of the future keynote. We're also going to do a breakout session at each event, focusing on how you can avoid your facilities falling back into the pre-pandemic protocols, because those aren't going to be good enough anymore. So I'm really excited to join you as your keynote speaker. We're also going to do a breakout session at both events. If you haven't signed up yet, October 8th in Mount Laurel, October 22nd in southeastern Pennsylvania. There's going to be a copy of this book you see over my shoulder to the left here, Health Wealth for You, for everybody who attends. It's a complimentary copy thanks to the Rothkopf Law Group. I look forward to seeing you all there. Stay home, be safe, make sure you're following those infection control protocols in the meantime. It's Dr. Josh Luke, and I'll look forward to seeing you then.
And there's Dr. Josh Luke live. So thank you. And would you like to say a few words, Dr. Luke? His microphone's not on.
Hey, can you hear me now, guys? Does that work?
Yes.
I will. There you go. Hey, I'm so excited to be a part of this. Wow, how much has changed in the last month or so. Now more than ever, the relevance of us getting together as a community, either online or in person, is more important than ever. And I do think I want to stress this, that as we invent a new normal, kind of state by state, county by county, it's going to be very important that we do get together in person, because right now what we're starting to learn is that the impact of the mental health and financial impact to each individual family, let alone the grief and the grieving process of knowing someone that may have passed away. All those things are weighing to the point that we're saying, hey, we've got to weigh that risk along with the fact that we're moving towards knowing how to manage this better. And nursing homes are kind of the last frontier in assisted living as it pertains to COVID-19, that the most challenging place to control this outbreak is going to be in the nursing home. So I think in the fall, we're going to have a lot to talk about. I think you guys had asked me to come back after the panel, so I'm going to leave it at that for now. And thank you again for including me.
Thank you, Dr. Luke. Even though you're apparently a Dodgers fan, we will let you slide. So, we expect next time we'll have to give you a Phillies number 40 Luke jersey.
Well, hey, that was my brother's jersey, actually. He played for the Dodgers in the big league, so you can cut me a little slack on that. He's a Yankee, too, so if there's a Yankee fans, he came up as a Yankee and actually was roommates with Derek Jeter. In the background, if you look a little lower, you might be able to see Derek Jeter's hat from AA sitting over there on my counter. I think there's some books stacked on top of it, but I'm also a Yankee fan. Is that even possible to be a Dodger fan and a Yankee fan in this day and age?
Well, if the Brooklyn Dodgers and the Yankees, I don't think so. They hate each other.
Well, thanks again for having me, guys.
So thank you for participating. Thank you for your kind words. We look forward to hearing future words from you later on in the year. So thank you very much for participating today. And Linda, I'm going to kick it back to you.
Okay. Thanks, Josh, and thanks, Jerry. And now, Jerry, if you want to share some of the thoughts about before we get going with the panelists and share your video.
Present the panelists, please.
Oh. Okay, so I'm going to leave their screen up. So now we are going to move on to the panel discussion. And as you can see here, we have 5 stellar representatives of the South Jersey business and senior care organizations. Unfortunately, one of our originally scheduled panelists, Linda Graff, is ill, but we're so thankful to her that she has arranged for a colleague to stand in for her. And you'll meet Jeff in a second. But Linda, we wish you well and we wish you a speedy recovery. So thanks for lining up Jeff, who is our first panelist. He is an executive team member of Morristown Visiting Nurse Association, where he serves as the Vice President of Business Development. He's been with them for the past 22 years and a nurse for more than 30 years. Jeff holds a Bachelor of Science in Nursing with Thomas Jefferson University. He works closely with our panelist, Linda Graff, and we're very appreciative that he's able to step up for Linda today. So thanks for being with us, Jeff. Our second panelist is Jennifer Herzog. Jennifer is Vice President of Marketing and Business Development, Mid-Atlantic Region for Marquee Health Services, a New Jersey-based skilled nursing and assisted living organization. Marquee has 9 New Jersey locations and 4 other locations in the northeastern United States. For more than 6 years, Jennifer has led the census growth and business development strategies of Marquee Health Services. Prior to joining the Marquee leadership team, Ms. Herzog was a division director of sales and marketing for Extendicare, where she had responsibility for oversight of a 4-state, 52-center territory. She graduated from the Pennsylvania State University with a BS in Health Policy Administration. And we're so lucky to have you with us here today, Jennifer. Thank you. Representing the business sector is Christina Renna, the president and CEO of the Chamber of Commerce Southern New Jersey. Christina assumed her post at the Chamber in January 2020 after serving in a variety of capacities on and off since 2007. In 2010, she was selected by Governor Chris Christie to serve in his administration. One of her posts was Director of Intergovernmental Affairs, where she dealt directly with state and local government officials across the state. Ms. Renna's past work experience also includes government affairs and communications work at South Jersey Industries and a legislative aide to former Assemblyman John C. Gibson of the 1st Legislative District. She received her BA in Political Science from St. Joseph's University in Philadelphia and her master's in Public Administration with a minor in City Management from Villanova University. We're very glad that you're here with us today, Christina. Thank you. Our next panelist is Mary Underwood. Mary is Vice President of Memory Care Services at Artis Senior Living Management. Mary is a social worker who has been working in the field of senior care for over 30 years, and her primary focus has been on working with those with memory care issues. She's worked in a variety of settings, including adult day, skilled nursing facilities, and assisted living. Mary has a strong commitment to education and training. She has presented at several statewide Alzheimer's Association conferences, the National Alzheimer's Association Conference, and the World Congress Conference. She received her BSW from Juniata College in Huntington, PA. In addition to being a professional, Mary is also the adult daughter of a father with dementia. For the past 5 years, she has served as his advocate, and we welcome you, Mary. And last, but certainly not least, is Jill Vigiano, a master prepared registered nurse and seasoned healthcare executive. Jill used her expertise in home and community-based services to champion the introduction of PACE, which is the program of all-inclusive care for the elderly, and she integrated it into New Jersey's long-term care mix. Jill currently serves as the executive director of Inspira Life, the PACE organization serving Cumberland, Gloucester, and Salem counties. In 2019, she was elected president of the New Jersey PACE Association. For many years, Jill was president executive director of Life St. Francis, New Jersey's first PACE. She then moved into serving a dual role at St. Francis Medical Center as VP of Senior Services. Prior to her involvement with PACE, Jill held leadership positions in several home care and senior service organizations and began her career as a visiting nurse. She holds a Master of Science as a community health nurse clinical specialist from Rutgers State University, Newark, New Jersey, and a Bachelor of Science in Nursing Education from Albright College, Reading, PA. Thanks for joining us here today, Jill. And now, Jerry, it's time to get started. The panel is all yours.
Thank you, Linda. And we'll wait for the panelists to come on back on the screen, I believe. All of them. So thank you once again. And it's the nice part about the panelists, and it's really an esteemed panel, is we have a nice cross-section of both the business and healthcare communities I want to point out with. We really have what I would refer to the continuum. Christina, you represent the business world as from the Chamber of Commerce. And in this case, Jeff, you are home care and hospice. And Chris, as well as Jennifer, you're nursing, and Mary, your assisted living. And Jill, you represent adult medical day and home and community-based settings. So it's nice that we have a cross section. So to understand what each has been dealing with in their specific sphere and their lane, which, and we're all, and everything is interrelated, as we all know. So let's really get into it, because that's what we are here for today. So as I said before, what I'd like to do is talk about where we started in early March, where we are approximately a month and a half to 2 months later, and maybe even more importantly, where we're going, because that's really what matters going forward. It's great that some of the good what went on, some of the bad, but where we're going is we can only do what we have control over, and that's where we're going. We can control our own destiny, which I would like to get into. But let me start, Christina, with you, if I would, from the business world. Can you talk about what life was like in February 2020, pre-COVID-19, from the business sector, what you're hearing from your constituents, your members, business associates in South Jersey, and specifically, what processes during normal times did you have to change? And can you just talk about the strategies that we all had to reinvent ourselves? But I'd like you to address the business side, then we'll hear more from the healthcare side.
Sure. Well, thank you so much, Jerry, and the entire team for having me. I really appreciate the opportunity to join everyone today, albeit in a virtual setting. This is certainly the new normal for all of us, and it's taken some getting used to, but we're all managing, and I think getting along quite well with it. So again, thank you for having me. It's interesting from my perspective, as Linda kindly mentioned when she introduced me, I've been with the Chamber on and off since 2007, but I've only been in the leadership role of president and CEO since January 1st. And if you had asked me on January 1st what my long list of worries and concerns were for my first year taking over this phenomenal organization that's been around for 148 years, a global pandemic was not on the list that I had worried about or thought I had to plan for. So it's certainly been a very unique and you know, candidly a challenging time, but we're doing okay. Our chamber does approximately 140 in-person events a year, and none of those events really have less than 50 people. So early on, you were hearing the governor first starting to say events with 50 or fewer people can continue to go on. We were already kind of hamstrung by that because our chamber is so large and comprehensive that really all of our events fall under that category. So we were forced to pivot pretty quickly and identify, you know, essentially how we were going to continue to provide our members value in a COVID world. I have always been, and my predecessor, many of you watching know Deb DiLorenzo, who served this chamber for 25 years as president and CEO, had this philosophy, and I completely agreed with it as well, which is that we were very hesitant to do virtual programming because as a Chamber of Commerce, our goal is to encourage people to physically come out, shake hands, connect with people, exchange those business cards, build relationships, and then go ahead and hopefully do business with each other. So we thought virtual platforms, you know, countered that. And if people had the opportunity to stay home and get value, they wouldn't be coming out to our events, which is nothing we wanted to encourage. We wanted people to come out and physically meet each other. That's all going to change. It's certainly changed now because we have no choice. And we've, as I said, pivoted, I think, pretty successfully since we're 7 weeks now that we've been working remotely and we're fully operational. We've had 33 webinars that have attracted over 7,000 participants. So certainly hit the ground running, went from never doing anything virtually to learning pretty quickly how to do this stuff overnight and doing it in a way that provides value to members. And
we're going to come back to you and talk about some of, you know, from the business side, you know, what's going to remain, because there's some good here that I think that will come out of things from the business side. Whether do we need 5,000 square feet with 2,500 square feet office? We're going to come back to talk to you from the business side. So, but I thank you and where we're going in the future. But if you'd be so kind, I want to go to Jeff for a moment. Jeff, so from Morristown VNA, you handle hospice and home care. So it's home and community-based services. So can you talk about where you were in February and where Morristown VNA is currently, and some of the processes that had to change related to home care, related to ensuring that your staff is safe in a home and community-based setting, and what processes changed because, and what has it done for your organization as a whole as well? Can you touch upon that, Jeff? Jeff, you're muted. All right, while Jeff is working on some technical difficulties, Jill, you're the LIFE program. So let me talk to you. Can I pose the same question to you, Jill? LIFE is living independent for elders. So in case, so can you give us a little bit for those who don't know about your program? And I would pose the same question to you that I just posed to Jeff. And Laura,
thank you for the opportunity.
And Laura, can you work with Jeff in the background to fix his technical issues?
I'm back, Jerry, when you're ready.
All right, we'll go to Jill and back to you, Jeff.
Okay, so thank you, Jerry, for this opportunity. So we are a PACE organization, which is a program of all-inclusive care for the elderly, focused on keeping seniors independent. And as an all-inclusive program, we have an interdisciplinary team that provides care for participants across all settings. And the center, the PACE Center, is really our hub. And that is where seniors come. Some of them come daily, Monday through Friday. Some come a couple of times a week. But it's recreation, it's socialization, it's meals, it's the opportunity to interact with team members. It's the chance to have therapy. It's the chance to also be seen in our clinic by a primary care provider. So when COVID hit, we went from the center being the hub where 120 seniors might gather on any one day with another 70 or so staff in the building, to having to reduce that social interaction. So that was a dramatic change. What we did initially was reduce the members we were bringing into the building. We started to wean it down to those that really needed that service most critically. And we've always provided in-home services. We have home health aides, home care nurses, and all of our team members actually provide care in the home. But the center was always the hub. So we started to move to more home-based services. And then even after the state closed adult medical day centers, they did let the PACE Center stay open a little bit longer because they understood the varied nature of services provided there. But then we also got the order that we needed to reduce to the least critical amount of care in the center. So with that change, we went to all home care services. We still have our center open because our staff need to come in and get their protective equipment that they need for making home visits. But we went to home-based services. So our nurses, our home health aides, our primary care providers, our therapists are all taking care of participants in their home. The big thing that didn't change was transportation. Transportation is so critical for keeping seniors connected. And we have a fleet of about 14 vehicles with drivers and transportation aides. Those staff continue to bring participants to essential appointments like dialysis appointments, but they also took on a new role. They started to be the food delivery people, because one of the things that seniors relied on when they came to the center was a meal in addition to socialization. So now we have our transportation team providing, they drop off medications, they drop off supplies, they're also dropping off food supplies to our participants. We're keeping in touch with all of our participants with phone calls at least once a week, and sometimes as much as daily, based on the acuity of the individual. And when we make those calls, we can assess what other needs the individual has. So transportation is bringing all those things. They've also started bringing out activities for them, because rec therapy is a core service of a PACE organization. And most of those services are usually delivered in the center, but with now people being confined to home, we're bringing the activities to them, including we're doing some phone-in Bible studies. We're figuring out a way to do bingo so participants can participate in bingo from home. So that's a quick overview of some of the things we did and what's changed.
Yeah, I mean, thank you for that. And there are, I mean,
You're
one
welcome.
of the, life and the PACE program is wonderful. And we counsel our clients to enroll in the PACE and Life programs. But one of the impediments is, okay, I got to get mom or dad out and ready for the for the transport, for the van to take them. So, and which is very difficult, or mom and dad or my spouse doesn't want to go, and I can't force him or her to go. So one of the things that may consider is bringing the Life program virtually. Yes, bingo. My family and I played virtual bingo yesterday, and my daughter was so excited. She won a free burger. How exciting is that? And it's fun. It's different, you know. It was Crazy Hat Day, so we each put on a crazy hat. So there's ways to make it fun, but you can't. It's still, human interaction is so important. So thank you for your thought. Jeff, let me come back to you. You good to go now?
Yes, hi, Jerry.
Hello there, Jeff.
Hi, everyone. It's nice to see everyone and be connected and see some familiar faces and know that you're all doing well out there. Jerry asked me to go back to February, so I'd like to go back to that point. It's an organization, you know, we're prepared for emergency preparedness and for infection control as part of our routine and requirements to provide care in the home. But looking at COVID, I think initially one of the challenges for us was, number one, you know, what are the CDC guidelines for this new pandemic that's coming our way? And also looking at our supplies that we had in order to meet the needs related to PPEs. So having the protective equipment for everyone was key for us. So as we looked at ourselves as a business where we have a building here, where we have home care, hospice, community counseling service, where many patients come to us, we had to think about how we were going to keep our people safe, how we were going to keep our patients safe and their families as we move from house to house and from many of your facilities that are out there. How do we keep your staff and residents safe? So we had to look at this as an all-encompassing situation that involved more than our nurses and our patients out in the field. So we started at our re-educating our staff. We started mobilizing ourselves to get as many PPEs and make those connections as possible. We wanted to comply with our partners out there in the post-acute continuum on what their needs for access for the building was. And so as we started going through that, we had re-educated our staff. We put in place what we needed to, was regarding monitoring tools to make sure that what kind of an environment were we entering into, and making sure that our staff were safe and well as also. So with our guidelines, what we did was we reinforced infection control. We started to provide masks for our patients. And the other challenges that we had in moving forward as we were doing this was looking at our supplies and, again, safety. So we had to look at testing that was available. We wanted to make sure as we were taking patients into our continuum of services, what we needed to do for them and their family members, and also our staff, to keep everyone safe and compliant with CDC guidelines. And I think we accomplished that well. So in our offices, we reduced our offices. We have a lot of our staff working mobile that can. So we're able to sustain our normal flow of work by doing that. We do have people coming into the office. We've initiated telehealth for our patients in the home on hospice and home care. We found other creative ways to visit people to make sure that they're safe and stay in contact with their families. We have our counseling center that's gone up entirely on telehealth, which is something new. And so that's been working very well. So there are the things that we're doing. I think some of the other challenges, Jerry, from a business perspective, is looking at financial and human resources side of things. I think when you look at some of the initiatives or mandates that the state has put down in regards to keeping everyone safe. So daycare has closed, schools have closed. Our staffs are mothers and grandmothers or parents. So, you know, we had to work with them. So we have a lot of leave of absences. We have to keep them safe. Some people have been sick and are back to work.
Right.
So we have those.
we're going to touch upon some of the staffing issues, and I'll get Christine's from the business community, because when we go back to work, whenever that may be, especially in the Philadelphia, South Jersey area, which still is several weeks away, it appears, compared to other states that are opening slowly but surely, starting possibly today or at least tomorrow, May 1, that is. So a little different in our neck of the woods, certainly, I would say. But some of the issues are not going to change. Schools are going to, well, it hasn't been official yet, but let's assume schools are going to be closed the rest of the year in New Jersey. I don't think that's an official word yet. Right now it's till May 15th, I believe. But Philadelphia, PA schools are already closed for the rest of the year. So we're still going to have the child care issues. We're still going to have the elder care issues as well. So some of the, and we go into the summer with camp. So we're going to get into that as some of the future issues, but thank you for your thoughts. Mary and Jennifer, I would like to move to long-term care communities, which you both are affiliated with, obviously. And before we do that, I want to get and I want to hear where we were and where we're going, where you were. But Laura, I would like everyone to watch the Rachel Maddow 5-minute video. Some of you may have seen this, some of you may have not seen this. By the way, and some of you may be saying, hey, it's Rachel Maddow, we know what type of viewpoint. No, actually, I think this would have been just as well received on Fox News compared to MSNBC. It's I would say, a really neutral way to look at the importance of long-term care in the COVID-19 pandemic. So if we can take off our videos for a moment, please, and bring them back with the end, thank you.
Do you think that it makes
It is no way done. So the second question is, if let's say we have this affidavit, and the family can't find, but let's say it actually is attached, this transfer property is not.
I know this voice.
Sells the property. Will it clear title if the family and dad's wages, right?
All right, we good to go now? Everyone can hear us?
We're good to go. The panelists just need to unmute themselves.
Everyone can hear? All the panelists, can you hear? Is that a yes? Good. Mary, you need to unmute yourself. You good? No, you can't. Jennifer, can you hear me? All right. Laura, can you unmute Mary and Jennifer and all the panelists?
All right, you all have control again. Sorry about that, guys. Are you trying to unmute yourself, Jen?
No?
Okay, Christina,
I'm unmuted now.
thank you. Yes,
I am unmuted.
There you go.
thank you, everybody. I think we're good to go.
All right, well, everyone,
Unmuted
Mary?
now.
All right, well, I'm gonna pose, Mary, while you get situated, I'm gonna pose to this question to Jennifer and then Mary, okay? So, Jennifer and Mary, there's a lot to unpack there and a lot of good, I think you would agree, a lot of good stuff that was just heard by the medical director, the physician at the Jewish Home in Los Angeles. So, but we will get into those very important issues. But Jennifer, let me start with you representing Marquis from the nursing home side. Can you talk about pre-COVID, where we were and what the process that you had to adapt to, whether it's with staffing, obviously with infection control procedures, with the services being provided, addressing the concerns of families, etc.?
Absolutely. Thank you, Jerry. So back in February, we were operating 2 outstanding skilled nursing facilities in South Jersey. 2 you may all be familiar with, a facility in Mount Laurel by the name of Laurelbrook, and a new acquisition that we were incredibly excited about in Moorestown, a facility now by the name of Cambridge Rehabilitation and Healthcare Center. We were operating with new excitement at this new acquisition. We were continuing to build on a very strong foundation of exemplary care in Mount Laurel. And suddenly we began to learn more about COVID-19. We heard, about the unfortunate situation in Washington and listened. Didn't learn a lot at that point, but began to move forward with precautionary measures with an abundance of caution, deciding independently ahead of state guidance to close our doors to visitors, to no longer allow family members to visit. We did that on March 12th, and on March 17th, our worst nightmares came true when we were contacted by a local hospital to ask us if we were aware that of 5 of our residents that had been hospitalized and the likelihood that these individuals were positive with COVID-19. None of these patients that had been hospitalized exhibited the symptoms that had been described to us, the signs and symptoms that our staff was looking for. None of them had high fevers. They exhibited very different symptoms. So very suddenly, COVID-19 in the Marquee organization was born. We quickly went to work. That evening, we had an entire corporate leadership team dispatched to that center. We worked hand in hand with a medical director who was on site immediately, assessing all individuals within the house, getting those individuals that were appearing to be exhibiting symptoms of all kinds, including those that we weren't recognizing as potential symptoms in the beginning, treating those individuals with what we believed to be appropriate treatment, although yet not proven. We did realize great benefit and value with how we went about it. But you can imagine the fear of the staff involved at that first location. This was the first location in our entire organization to be impacted. So, we didn't have a lot of experience under our belt. So speaking with that staff about the unknown and trying to reassure what we didn't know, from a PPE perspective, while we didn't have it day one, we had it very quickly. Unlike many operators that you're hearing about in the media, we are fortunate, I'm very fortunate to work for an organization that had the means financially and the infrastructure available to very quickly go to work in securing PPE from literally all over the world. We brought PPE in very quickly. Our staff was very quickly protected, which was great. But also, even that level of protection, you can imagine the fear is still there. So from the get-go, biggest challenges were, staff wanting to walk off the job out of fear, really reassuring them that we would provide, and we were providing them all of the equipment that could keep them as safe as absolutely possible. Dealing with, we had to change rates to keep people there on site, continuing to care for our patients. You can imagine the fear of family members. They were no longer, obviously, 5 days prior, we ceased visitation, so they were no longer permitted to be in the centers, and then we're calling them to let them know that COVID-19 was in fact present in the center. So
let me hold that thought. So, because I want to go to Mary with some of the other issues that you may talk about. And first of all, Jennifer, I saw a LinkedIn post with a person I know who owns several nursing homes in New Jersey and beyond. And his post this morning was, "I'm devastated. We lost our first resident," meaning due to COVID-19. And he was devastated. And I thought that was a very honest, very humane, as the owner of the nursing home, he thought he was undergoing personal responsibility for the loss of his resident, saying this is someone's mother, this is someone's family member. And I'm sure you feel the same way. We're going to talk about some of those issues that follow, specifically related to, what's your biggest need right now, which we'll get into shortly. But Mary, I want to go to you. Atria is a memory care community.
Artist, yep, Artist Senior Living.
Artis, I'm sorry, Artis
That's
Senior
okay.
Living.
It happens more often than we would want it to. But yes, Artis Senior Living.
Thank you for politely correcting me. So Artis is a memory care community.
Yes.
So, and there are specifically issues related to memory care, specifically with advanced dementia or Alzheimer's, that I want to try to focus on, and the concerns of family members, because as Jennifer said, and I'm sure Mary, your communities also started, and with CDC guidelines, et cetera, and CMS guidelines, banning visitation by certainly the second week of March.
Yeah.
Banning all visitors, banning all communal events, no outsiders, only for compassionate care, which basically means end of life circumstances to allow family members who are properly protected in your community. So so with residents, many residents are quarantined to their rooms, but residents can only be quarantined to rooms if they understand why they are doing so. So specifically in your memory care communities, which you specialize in, what's the interaction with the residents, and more importantly, how do you create additional interaction among family members? I've seen, family members going up to windows and such like that, but for those with dementia, they don't know why. Who's out there? Why is someone spying on me, etc. So can you talk about some of the issues how you have addressed them related to specifically memory care?
Sure. And I think, similar to Jen is, the difference is when people are being homebound and they have to stay home, we have 64 memory care people living in the same home. It is their home. And how do we socially distance 64 memory care residents while maintaining the quality of life? I will say, and we've had this conversation many times, when I look at how people are dealing with this, our residents are actually faring the best. And I think it's because they're not watching the news every time. They're not hearing the numbers. We're providing them the quality of life that they need, that in order of everybody, our residents really are faring quite well. Fortunately or unfortunately, they don't have the concept of time. So they don't know the last time they hugged their loved ones. The families do. And they struggle, they're next in line struggling. And the associates are really struggling also because, as you talked about your friend who, the nursing home administrator, and Jen can speak of it too, it's part of what we do. We expect our residents to pass away. We give them the quality of life for the end. But this feels different. I think there does feel a sense of responsibility a little more than prior, but our families have been beyond outstanding, I have to say. A lot of people are able to do the FaceTimes and the video chats. And when you work with people with memory loss and have some form of dementia, we weren't sure how that was going to work. And they have really shocked me. And I've been doing this 31 years, and I was surprised at how well many of them really adjusted to doing the FaceTime and the window visits. And so we've been spending, there's some days where we're doing 35 FaceTimes with families. Just so they can see their loved ones. And for our residents with, who are more progressed, it's not about them visiting their sons or daughters, but the sons and daughters actually being able to see them. So again, I'm surprised how well our residents are doing with understanding. One of the things we train a lot at Artis is their brain is broken, but their heart is not. So their brain may not know exactly what's happening, but their heart knows it's something pretty important. It's something pretty serious. And they've been, doing what needs to happen. We've been spacing our meals, for our residents to stay in their rooms it's just not the best thing for them. But we are doing the PPE, we're doing the infection control, we're not doing the large group programs. But we do have residents who will sit in the dining room 6 feet apart from each other, if not more so, to have those moments of socialization. You've talked about, we've done the window visits. Even things like we've found so many amazing people who are volunteering their time that in one of our communities, our residents did a virtual visit to a farm so that they were able to go and see farm animals. We had a student from Gallaudet who did virtual sign language classes for our residents. So it really is being creative, but it's been really tough for our families, and our associates do take it very personally. We've been very blessed. diligent and blessed. I think it takes both to fight this. We've had some communities that have been hit harder than others, but in our Evesham, New Jersey community, knock on wood, has done very well with no cases. And I know we'll talk about it with staffing. One of the difficulties we have is that many of our line staff, our CNAs, work more than one job. And how do we balance them going from, Jen shaking her head, how do you balance somebody working in one place that's...
We're gonna come back to that. I think that's an important issue because as I think some of the studies have shown, a lot of the spread related to COVID-19 is spread by staff who work in multiple settings. And it's tough to prevent them. Or any employee who's going home and you can't control where they are off duty, so to speak. And Christina, let me talk to you from the business side of things. What are you hearing from the South Jersey Chamber members, specifically related to fears that their employees have with, we got to get business started. We got to get the economy started. We can't stay home forever. So from a business economic perspective, which we're all involved in the economy, whether it's healthcare or other types of economic engines, what are you hearing from your members related to going back? What are their team members' biggest fears? And what is, and we'll talk about going forward over the next several months, what will that look like? But what are you hearing from your members about going back to the office, the concerns they have? Of course, the data is unknown right now, specifically in New Jersey, but what are you hearing from your members?
It's everyone is very anxious to get back to work. And I think that what we hear the most is that employers of all shapes and sizes, all industries, they feel like they can make the responsible decision whether or not their staff and therefore customers can be served in this COVID environment or not. So I think they're a little bit frustrated by the government oversight that's happened. Right now we're dealing with essential and non-essential businesses. So our essential businesses that are outside of healthcare are struggling with the PPE demands that are needed because there's been, and rightfully so, such a high demand in the healthcare space for PPE, and that's where most of it is going. But the supermarkets need it, the manufacturing companies need it that are essential, and they don't have the resources now because of the economic slowdown to purchase these items. And donations are not primarily going in their direction, which of course no one is complaining about, and they certainly aren't complaining about because they understand the need for it to go to healthcare. But it's a struggle because, like I said, with the economic slowdown, it's something that they need to pay for, and businesses are going to have a hard time doing that. That will roll over the more non-essential businesses become essential, or the more we open the economy. If we open the economy, we're going to have to supply our staff, and therefore our clients are going to be mandated to come into our facilities with this kind of gear. And the problem is obtaining that gear and with the constraints that, again, businesses that have been shut through per government mandate are probably not going to have the revenue to be able to purchase PPE. So I think that's probably the biggest thing that we're hearing. But employers are very anxious to get back to work, very anxious for government to kind of let them make the decisions that are best for their business and their clients. And they feel like they can do that in a safe environment if allowed to do so.
Thank you, Christina. Jeff and Jill, for those working in a home and community setting, can you talk about, during the past couple months, really what has been your biggest challenges, whether it's with hospice or home care, going into the home, someone's home, and what do you see as have been the biggest challenges to date, and how have you, as a company, attempted to overcome them? Jeff, we'll start with you.
Well, I think one of the things, as I mentioned earlier, was trying to balance the safety of our staff and our patients, PPE utilization, anticipating volumes of discharges in the continuum. I think there are real challenges, and so with testing, as an example, getting testing back as soon as possible, because as you can imagine, a lot of these patients are receiving a lot of resources at home, whether they're having nursing, PT, OT, speech, wound care, those sorts of things, daily visits. So we had to make sure that we had our testing done, to use our resources we had available to handle the volumes. I think that was one of the initial challenges that we had. And then, of course, as I had said before, is maintaining our staffing and to be able to meet the needs of our employees as well as the patients at home. As many as I said, many of our nurses and much of our staff now have children to care for at home or parents to care for at home. So we had to take that into consideration. Where hospice is concerned, I think Mary touched on that a little bit. That's some of our, one of our experiences. It's very difficult caring for patients at the end of life, and you cannot be at bedside as you normally would be with your staff. So making those adjustments, not only controlling pain and symptom, but the emotional, the end of life needs that a patient really has. So we made those adjustments as well, and I think they've been some of the difficulties that we've had.
Thanks. And to reiterate some of the emotional side of things, our elder law firm, which for obvious reasons being an elder law attorney, an elder law firm has a great deal of clients who are either in assisted living or nursing home. Unfortunately, we've lost close to 20 long-term care client residents over the past 4 weeks. And another 15 to 20 have probably been diagnosed with COVID. So we're feeling it personally. And Jill, I know that personally you're feeling it as well. Am I correct? Now, my understanding is your father is in a nursing home and is now COVID-19 positive.
That's actually Mary. That's Mary.
I'm sorry,
Yes.
Mary.
That's okay.
Right.
That's okay. Yeah, my dad has been in a nursing home for about 1.5 years, and 12 days ago we got the call that he was, and we had not been able to see him, not been able to visit. And it's a punch in the gut because of the news and the media. You hear the highest risk, and you naturally go to the fact that this is going to be the end of his life and we can't be there. We are incredibly fortunate that 12 days in, he is pretty symptom free. No more fever, has not had a cough. So he is one of the lucky 82-year-olds. But again, you go to, when you hear that in your senior population, your mind goes to one place and one place only.
Great. So yeah, so you're feeling it personally, and we're feeling it. We consider we get close. We especially our geriatric social workers who have daily contact with them in many cases. Sometimes it's adopt a daughter or adopt a granddaughter. So we're feeling it, and our staff is really emotionally drained. It's as we're all feeling it as a healthcare long-term care community. There's no doubt this is draining. We're going to hopefully end on a positive note. So don't relax a moment. All right. There's all medication for that. It's all good. So or your favorite beverage, as the case may be. And all my colleagues, elder law colleagues who I speak to weekly, say they've never drank so much in their life when they get home from work, by the way. And you may all feel the same way. So thankfully, I guess there's delivery still out there. So
we're going to need AA.
Yeah, you're cut off. You cut off. I heard AA somewhere in there, but I understand what you're saying. So Jill, can you talk about, several of you mentioned the importance of staffing and how the emotional toll, difficulty, and staff are afraid. And and that's very reasonable. Can you talk about, related to running an adult day center and the LIFE program, some of the challenges related to staffing you have had?
Sure. I want to refer back to a comment Jeff made early on about keeping up with CDC guidelines. I think one of the most challenging things for everyone, staff and administration, has been just keeping up with the latest. Like, you're adapting to one set of information, trying to make sure you have the PPE and the appropriate, guidelines implemented, and then things are changing. New information is emerging. We're fortunate to have the Inspira organization behind us with infection control preventionists and so forth that have helped keep us up to date. So I think giving staff accurate information has been one big challenge, because when you can do that and assure that they are protected, then they're confident to move on. So getting information out has been a challenge. We had a big decision in trying to figure out which were the essential staff we needed. We had a goal from the beginning to reduce the number of people who are being exposed to participants and the public. So figuring out, who was going to continue to work, who might need to be furloughed was a challenge. The other challenge has been expediting the implementation of technology. There's things that we've been working on, but now all of a sudden, I think a few of us said, all of a sudden now you do need that technology, and making sure that staff was comfortable enough to be able to use virtual technology and remote technology for patient visits was another challenge. And then I think just the emotional support. Again, Inspira has been really very helpful. They've made counseling available to staff. They've done things for convenience, like having a pop-up market, a virtual chapel, things to support and sustain staff through really challenging times. But staff are confronted with concerns about family members who may be ill at home, maintaining their own safety. And many of them are parents, and we've talked about, parents having to suddenly become a fifth grade teacher, when they don't remember what they learned in fifth grade all that much. So all of those multiple challenges have really been difficult for staff. And we've just been aiming to stay in touch. We have a daily call every morning to manage all of our 275 participants with all of our core team members. And there's often we share a positive thought for the day or a joke. People reach out and touch each other through virtual chats during that opportunity. So those have been the challenges. And PPE has been discussed. We've been fortunate, again, Inspira has been able to help us maintain an adequate PPE supply. But making sure staff are comfortable knowing that they are adequately protected has been a big part of the challenge for us.
Great, thank you for those thoughts. What I would like to move to Mary and Jennifer, specifically related to some of the challenges, but based upon the video that we just saw 20 minutes ago. Oh, by the way, I forgot to add, if anyone has any questions, I know Laura Nelson has put you there, has typed in the chat box. If anyone has any questions for any of the panelists, feel free to type it into the chat box, and we'll make sure that's addressed. We're going to save some time for Q&A. So if anyone has any questions, feel free to type it, and we'll make sure that your question or concern is certainly addressed by the panelists. So back to Mary and Jennifer. You saw the video. We have heard some horror stories. I mean, we've saw what happened in nursing home in Sussex County. We've seen there was an article in the Philadelphia Inquirer about the VA home in Chester County, and we've heard horror stories. And in the news and press, and sometimes I would argue, and understand my perspective, I'm a resident advocate. We do not represent long-term care communities. I represent residents in those communities. So I'm an advocate for the residents. But we've all seen horror stories, but I think it's fair to say that, rightly or wrongly, okay, long-term care communities, specifically nursing homes, have been vilified in the press. And some communities, I would possibly with good reason. And as the Rachel Maddow interviews showed, even excellent communities have problems. So I would say, as a patient advocate, as a resident advocate, I think COVID-19 in your buildings is inevitable. But what's not inevitable is what you do once it gets into your building. That is not an inevitability, at least negative result in the long run. So with that said, and some of the information, so tell me what are your biggest challenges to date related to long-term care? Mary, we'll start with you. And specifically, can you address maybe what the media is not reporting? Right. What they don't see, what you see every day, as the heroes, so to speak, what you see every day, someone making barely minimum wage and putting their life on the line. So, and that's what arguably you don't see. So, but Mary and Jennifer, could you address some maybe what's not officially reported that you see every day?
Yeah, what is not being seen is how well most communities are. I do think that in general we are. And I think the biggest problem that, even watching the stories, I'm up here in Connecticut as a caveat here, so, and it's raining and miserable here too. But what we find is the stories we see is primarily because of a lack of a communication. We as a company made the decision right out of the gate that we are going to be very transparent. When somebody tests positive, we're not going to say who, we have the HIPAA laws, but families are going to talk, they're going to see things on the news. So we have sent out daily updates to our families. We post on Facebook, on our pages, what we're doing, what we're preventing, even when we had a community with a positive. I think the biggest obstacle to the bad news stories is the amount of communication that you provide to your associates, to your families, because we have seen our families. I mean, we get tearful just thinking about how appreciative they are, and I'm sure, Jen, you see it too. You know, why we joked around saying we need WW, you know, it's every day somebody's bringing food and donuts and just constantly showering our communities with love and appreciation. People drive by and honk their horns just to say thank you. They're not seeing that, you know, we have residents making masks, we have people dropping in masks, we have hairdressers who use gloves for things that they're now bringing to our community. So they're not seeing the 99.9% of support that our communities are getting.
Thank you,
Jen.
And Jen, what are we not seeing that you want, you as an executive owning nursing homes, what would you like the public to know, and as well as other professionals who are not involved in long-term care, to know about what's going on behind the scenes?
So this is obviously a very passionate topic. It's been a heart-wrenching last couple of weeks as the media attention has heightened. I can tell you what I witnessed as an executive who is boots on the street in my facilities, working on the front lines, not clearly as frontline as our direct caregivers. But what the media doesn't see is a pool of very committed professionals that are showing up every single day, scared out of their minds because they are healthcare providers who will not let their residents down. They're showing up masked, gloved. They're holding the hands of residents who are scared, in some cases scared of COVID, in some cases scared of being stuck in their room all day for weeks on end. In some cases, scared of what's to come because they haven't seen their loved ones. They are not seeing a committed healthcare industry of long-term care professionals that have done everything in their powers to mitigate spread, to ensure that they are doing everything they know and using every resource in their power to make sure that another life is not impacted, or to do their darndest to make sure that in everything that's available to them, that they've done their best. And it's incredibly, you know, the nursing home industry, for years, we've lived through the scrutinization, you know, and we're used to that. But in the height of a pandemic, to see people putting their lives on the line to save the most vulnerable of the vulnerable, and to have the media attack long-term care as it has, it's disheartening. And I don't know when it'll go away, but I can tell you that it is impacting the people on the front lines in a very unfair way.
I would agree with Janet. And just to add a little bit to it, it's people aren't just coming in, and what they don't see, people aren't coming in just to do their jobs. That because so many people can't come into the communities and can't do the services that have been done by outside people, we had in one of our communities, we had David, who was a director of culinary services, curling women's hair so that they felt good about themselves, because you can't have the hairdresser come into the community. So they're not just going in and doing their jobs, which are hard enough, but they are doing anything and everything that our residents need to make sure that they have the best quality of life at the end of their lives.
Thank you. And actually, we're going to stay with Jennifer and Mary, because I see the passion, I hear the passion, and I love it. I mean, in the sense that you care. And so we all care, and I feel it through the video, through my screen. I hear the passion, and I feel it about how much you care about the residents and families that you work with on a daily basis, and your staff, because they're your family as well. And we'll talk more about that. But let's stay with Mary and Jennifer for a moment. Tell me a success story. You know, there's death and dying. We know that exists. I mean, New Jersey, you know, the New Jersey Department of Health has published the statistics for each community, and feel free to comment on them if you like, by the way, because it's hard to tell fact from fiction with the statistics, by the way. And feel free to comment if you have a comment on them. We would, our audience would love to hear it. But beyond that, tell us a success story, something good that you've witnessed over the past month or two.
I mean, we could, thank God we don't have another 2 hours because we could go on and do this. But I think it's, there's so many stories we hear of, families coming to visit on St. Patrick's Day at one of our communities. One of the granddaughters of one of our residents was in an Irish step dancing group, and they performed out in the parking lot. And our residents were all lined up in their windows so that they could see these, they can still celebrate St. Patrick's Day in some sort of way. Again, we have 3 communities currently that are not up and running. We've kind of put that on hold until things slow down. And we have people from New York going out to Chicago to help our communities out there, that people who are in healthcare and have it kind of easy right now and aren't in the crisis are running into the crisis and helping those who are in need. So again, there's a million little stories of FaceTime events, of birthday events, but Jen, I'll let you take this one now.
This is a great topic. So we have Laurel Brook, as I described, as one of our first impacted centers. So we are now celebrating nearly every day the discharges of folks that have successfully battled and rehabilitated with us and are going home. So I think we have our 4th patient discharging this week. If you follow us on social media, you're seeing this. If you don't, we'd love you to, because we are taking every one of these successes and making a huge deal. We are lining the hallways. We are hooting and hollering. We have balloons. It's a great event. It's a morale booster for these people that not only are celebrating wins, they're celebrating and mourning loss. So, it's something that we're taking very seriously. The PR end of this is incredibly important, again, given the scrutinization that we've received. So most recently, 82-year-old woman admitted post-ventilation in a local South Jersey hospital, came to us to recover, remaining COVID positive, stayed with us for about 3 weeks, and successfully discharging home with her husband. So people are recovering, and guess what? They're recovering in nursing homes too.
Yeah.
Thank you.
And I just have to say too, every week I have a group of program managers who I work with, the memory care directors. And every Monday I try to send them you've got this, you can do it this week. And every Friday it's you made it again. And last Monday I wanted to say, I don't want to give you a pep talk. I want you to tell me how you're feeling. Like, honestly, not how you want to feel, not what you hope to feel. I want you to tell me what you're feeling. And I got an array of answers. And I was actually, I got choked up thinking the #1 response, the word that they used the most was grateful. And I just thought of being anxious, of being scared. The #1 thing they said was that they were grateful for people that were supporting them and for, the support they are getting from the families and from one another. So they're feeling beat up, but they're also feeling grateful for those who are seeing the great work that they're doing.
Thank you. Christina, from the business, let's move. The goal now is to move forward. So we started out where we were in February, some of the challenges that we're continuing to face. And I would like to move forward now. Christina, from the business world, what are you hearing from your membership? What will, when things do go back, what will that look like from a business perspective? What do you see? What are you hearing from your members? What are you telling them, giving them some guidance? What are you hearing on the webinars? What will it look like 3 months from now, 6 months from now? What will it look like when the quote unquote we go back? What is the new normal going to look like, so to speak?
Well, so much of it is dictated by the vaccine and when that comes, and not just, people talk about the vaccine as being the end all be all solution, but then people forget that then everyone has to get the vaccine, and that's going to take a long time as well. So I think businesses are being, from what I'm hearing from our members, extraordinarily realistic about the fact that it's going to be a new normal, that term that we keep saying all the time. I think you're going to see a far more comfortable push towards work from home, especially in industries that never thought work from home would be possible and have been forced into that situation. I'm talking about things like your utility companies, some of your manufacturing companies, although most are open because they're essential businesses, but companies that always thought I could never work from home because our company structure doesn't allow us to. Well, they're doing it. They figured out a way to do it. Everyone's figured out a way to continue to survive and serve their patients, their clients, their members, whatever it is. So I think you're going to see more flexibility as it relates to people being allowed to work from home, seeing clients virtually versus seeing clients in person. And from a chamber perspective, where our goal is to hold events, we're really rethinking what I said off the top, which is, virtual events was something that I never championed, and we've had success over the past 7 weeks with virtual events. So what does that new model look like, where there's a combination of in-person and virtual events? Because there's going to be a period of time that people are still not going to be comfortable going back out to events, period, whether there's a vaccine or not a vaccine, whether the government limitations say 50 or fewer folks. If I'm holding an event or there's a wedding or anything, those tables are going to have to be spread out. There's going to be far fewer people sitting at the table. And I think that everyone's just going to have to realize that. And I feel like members are realizing that. And I come back to PPE equipment going to be essential to businesses and the economy's ability to come back too, because that's just a critical piece as well. And so we need to start thinking from an economic standpoint, a reopening the economy standpoint, how we're going to get PPE in hands of just regular businesses that don't necessarily work in healthcare to make sure everyone is protected in the right way.
And one of the issues, I think, excellent points about, and the other issue is, staff who may be, 60 plus, who are in that high risk category or underlying conditions. They have COPD, they're a cancer survivor, they have diabetes, etc. They have kidney issues. You can go on and on with underlying conditions. There's all types of underlying conditions, MS, whatever the case may be. So I don't practice employment law, but query, what's going to be the definition in the business world of a reasonable accommodation?
Right.
What type of reasonable accommodations we have to be made for people who have legitimate concerns. I'm not even talking about to be in 50 plus people. I'm just talking about 10 people gathered around a conference room table, or just the regular workplace. What is that? What is reasonable accommodation going forward? I don't have an answer. I'm not sure anyone does right now, but it's something that we're all, as in the business world, going to have to deal with. And we can get into government oversight. I know it was touched upon. We can have a whole separate program on government oversight. What will that look like from a healthcare perspective with OSHA? And what is going to be required? And what's going to be the cost to businesses to do all that? Restaurants, 25%, 50% filled. How are they going to make a living? And is that going to be pushed off to the consumer is going to pay? Someone is going to pay. So it's all to be determined. But so excellent points. Thank you. To Jill and Jeff, from a home and community-based perspective, what will the LIFE program look like? What will home care look like? Jill, let's start with you. What's 3-4 months from now? What's the LIFE community going to look like for you?
Well, one of the things that is continuing is our enrollment of new members. We believe, I'm really passionate about the PACE model of care and think it is the right solution for many seniors to keep their independence. So we're continuing to enroll new members. So several months from now, I hope that Inspira Life will have more members than we have today. I think the care that we're going to be rendering to those participants is going to look a little different. I mentioned technology. I think we're going to be integrating technology much more so than we had before. I think we're also finding more efficient ways to operate. Things that we thought were essential for our operation, whether it's how we meet or how we support participants, we're finding that there's other ways to do things. And the center, I think, will always be a really critical part of a PACE organization. And I do see more participants coming back to the center, but I think that will look different. I think we will have to maintain social distancing. I think we will have to be much more concerned about screening, probably the continued screening until the vaccine is available. We're starting to look at the ability to do some testing to figure out if people have immunity, because there's been so much said about asymptomatic people carrying this disease, that we're going to need to know who is at risk of contracting the disease, who's at risk of spreading the disease. And that's going to change, I think, how staff interact and how we interact with participants. So those are just some high-level things. We are planning to do an expansion. We're hoping to have a new center in Williamstown, and I think our plans will continue to support that as well. We hope that we're farther along 6 months from now than we are today. But we'll be strong, caring for seniors, but doing it in somewhat different ways.
Great, thank you. And for Mary and Jennifer, can you talk about what will long-term care look like? What will an assisted community, how will that be different? How will nursing homes be different? And specifically, can you touch upon some of the positives that you can take out of this, that you will continue to implement going forward? Look, in other words, try to end on a bright note. Can you touch upon each? Jennifer, we'll start with you.
Sure, absolutely. So where we go from here and what the future looks like, obviously, I think as Dr. Luke started, we anticipate that there will continue to be heightened attention to infectious disease and the control of that, and regulation and scrutinization around that, understandably. So we anticipate that. What we also anticipate and have already planned for is to be experts in the care of this population until there is some defined level of treatment or vaccination available. So we already have designated wings in each center that we operate, where we can safely care for COVID positive individuals. We also have step-down units in every center we operate, where folks that are admitting from the hospital are admitted and monitored and isolated for 14 days to ensure that we have made appropriate accommodations in the center. If they are COVID positive and a test, between the time they were originally tested and potentially became positive, that we are cohorting appropriately and have people safely managed in the appropriate areas of our centers. So we have adjusted to accommodate this new world. We are healthcare providers. So the need is to accommodate and serve COVID positive folks in our communities, and that's what we aim to do, while also continuing to operate as a traditional nursing home operator and subacute rehab provider safely in another location of each of our centers.
Thanks.
Well,
I'm sorry, Jennifer, sorry to interrupt.
No, go ahead.
Okay. I was just going to toss it over to Mary. Can you talk about, whether it's interactions with family members which virtually, can you talk about what some of the processes and protocols that you implemented consider carrying forward in a positive sense? Let's look at post-COVID.
Right. Well, I don't know when we're going to be post-COVID, but things like we monitor visitors. When a visitor comes into the community, we do a temperature check, we do a symptom check. You want to make sure that people who are coming into our community are not spreading, because again, so many are asymptomatic. As a company, we made the decision to stop doing move-ins for a short time until we felt like we were able to do that. Unlike a nursing home, we did have the ability to do that. And we're just starting to reopen, and again, looking at the process of what does the assessment process look like now. It never included COVID screening, and now it will. About bringing in personal items and how do we disinfect things, and because it is a balance between, this is the person's home, but we need to keep it safe, and it's a healthcare. So, there is that balance. I think Jen is right in regards from a regulatory point of view. We're going to probably see more in assisted living. But on a positive note, I hope people see the amazing work that is done with our seniors. I'm hoping it's not a staffing challenge, but it becomes a staffing opportunity, because people can see the difference having a job in a skilled nursing home or assisted living or in a daycare really does make for not just the seniors, but also for the families and just the overall quality of life. So my hope is that more people are choosing to go into this line of work. It's my hope. We'll see.
Thank you. Jill and Jeff, what, can you give us, what is going to be the takeaway here? What can you continue to do in a home care setting, whether this, assuming this crisis is on the downward spiral, and hopefully, whether it's with the fall and winter when it raises its ugly brow up again, as the case may be, what can you take away? How can you take what you've learned and be a better person, be a better healthcare provider, be a better parent, be a better child going forward?
Well, being a better person, I think, is really just all of us realizing how grateful we are for what we could call our normal or everyday lives that we have enjoyed, and we're looking forward to getting them back and seeing others enjoy that as well. I think for us, we're going to carry on providing care as we always have here. And we've gone through a lot of pandemics. We've gone through the Spanish flu. This organization has gone through polio. We're looking forward with great hope. So like everyone said, I don't think a lot of our processes that we put in place right now are going to change anytime in the near future. I think that we're going to be able to continue to provide high quality care in the home, maybe in some ways a little differently. And I think that all of us are going to continue to work in this continuum a little differently as well, and communicate as we need to care for the residents that we share in this community.
Jill, your thoughts on that?
And I would say the same thing. I think we'll integrate some of the lessons we've learned about how to be adaptable and support staff and participants in different environments, with more focus on home care and technology. But I think our mission will persist. I think the other thing we've learned is how valuable the bonds are among staff. I know Mary was talking about, and Jennifer, like how much we rely on staff, that people didn't run away. We're serving the most vulnerable population out there, the population that was in the beginning was most at risk, most likely to die from this. And staff just embraced their work. They wanted to know how to keep participants safe, how to keep each other safe. So I think celebrating healthcare workers, they truly are heroes. And I think remembering that and not taking them for granted as we go forward is maybe the one particular lesson I've taken from this, that I'll make sure there's always appreciation expressed for the dedication of our healthcare team.
Great. And Laura, by the way, thank you for your thought. Laura, do we have any questions, by the way?
We absolutely do.
Okay, let's take a few questions. Laura, again, I haven't seen the questions, so
Nope, I'm going to take care of that on this end. So one of the questions we have is from Elizabeth Wolf. She asked, I would love to hear the panelists weigh in on the value of care work. Jerry mentioned how many providers on the front lines are minimum wage workers. Is this going to change in the wake of the pandemic? Isn't it time that we finally value the lives of our care workers beyond quote unquote minimum wage? Do we actually show them that we care about them?
Yeah, I'm going to pose that question to Mary and Jennifer. Okay. So specifically, back to the issues of staffing. Many staff have to work multiple jobs because of the relatively low pay for, say, a certified nurse assistant. So Jennifer, can you address that question? I'm assuming you heard the question.
I did. I mean, I think it's a great question, Elizabeth. I think that there obviously is a lot that goes into funding from a state perspective into our level of care. And I know that I'm hopeful, as others within the industry are hopeful, that there is more attention and advocacy around funding for nursing homes that would allow for elevation of these wages. These people are heroes. They are absolutely working very hard and tirelessly today, as they have for years on end. So I agree with you, and it's well deserved. And hopefully with the good that comes from this pandemic. There's far more attention to needs that would support what you're discussing.
And again, I'm going to move on to the next question, Mary. I'll let Jennifer.
Okay.
Look,
Okay.
we'll save you for the next one. But
Okay.
again, different people have different views on that answer. I mean, I hear Jennifer saying fundraising, public government funding. The corollary of that, as a patient advocate, I would say, but even though government funding has remained stabilized and maybe dropped, there is significant investors still coming into the long-term care sphere where the government funding really doesn't impede the money flowing in. So you'll hear different people say different things. I would argue Jennifer's correct. Government funding is low and needs to be increased. Others, as a patient advocate, would say but millions upon millions of dollars are flowing into long-term care through private investors. So where is again, as a layperson, not having any horse in this race with owning nursing homes or assisted living communities, I don't know the answer, but I would say depending on which side of the aisle you sit on, you might get a different perspective. So Laura, next question.
Sure. The next question is from Cheryl Harris. She represents Artis Yardley. She asks, please share thoughts about the Rachel Maddow interview regarding testing.
Testing in the sense of long-term care. So Mary, will throw that to you.
All right. With testing, there's somewhat a false sense. I know a lot of people have been testing. There's these questions about negative tests. I think you just, again, you have to act as if everybody at this point right now is positive. That, you could test today and I could be negative. I can go to the grocery store, come home tonight and be positive. So I think testing there's a place for it in regards to, people that are symptomatic, people that are, new people moving into the community, maybe new move-ins. But again, the reality is, you can test negative today and test positive tomorrow. And I don't want to ever have our staff have a false sense that they're okay, that they need to act as if there is a positive, that they can infect somebody.
I could also speak to that and share one of the South Jersey facilities that I represent was part of the state's pilot. And a week ago had widespread testing in the center of all employees and all residents. The testing was done on Wednesday morning. Results came in late Friday or Saturday. So in that period of time, while widespread testing is great, in that period of time, folks, that could have changed, right? So by the time you get all these results and are expected to act on the results, which we did, a lot could have changed in that window of time. We had employees that still had not received word as of Tuesday. So that's nearly a week. And to expect to act on those kinds of results that are at that point no longer likely valid or 100%, it's good to know, but I agree with Mary and her feedback in that we're treating everyone presuming they are positive. That's the safest way we can move forward at this point.
Or we'll take 2 more questions. So pick out a good one.
All right. Well, next up we have Alicia Kagan. She represents the state of New Jersey Veterans Services. She asks, do you see a positive shift going forward for the use of technology in healthcare? Things like telehealth, fever tracking apps, etc. Will these be more accepted now as an alternative? Which of the temporary regulatory changes do you think should and will stay in place?
Jeff, since you touched upon telehealth, I'm going to throw that to you if you don't mind.
Sure. Morristown VNA has been providing telehealth for 15 years, so we see the positive aspects of that, and we also see some of the things that there's limitations to it as well. I know that our counseling center has had a very positive experience with telehealth, and that is probably something that we're going to be moving forward with. We're evaluating everything as we go. I think those apps are good. I think that they will change and have a positive impact. We look at our clients, our average age is probably 78 years old. and they're living in their home independently. So there may be limitations on that. But yes, I do see a place for telehealth and telemedicine in general moving forward.
Great. One more question.
Okay, our final question is from Nutan Ravini, representing Navini Associates. The question is, are any of the panelists facing any cultural issues like ethnic food or visitation in their facilities, and how have they addressed them?
Jill, we'll start with you related to, I know in the facilities, we'll start with you maybe working in the LIFE program with dealing with different ethnicities, and then possibly Jennifer or Mary can comment on that.
So we have a fairly homogenized membership. We do have African American participants, and then we have about 20% who are Hispanic. And I guess it is those who are primarily Spanish speaking that we've had the greatest challenge with. Many of them have, Spanish as their first language. So making sure that all of our materials are provided in their language is important. And frankly, we haven't been able to adapt the foods we're delivering to meet ethnic, preferences, because we're looking for shelf-stable things. We're not cooking meals. So that has been, probably a greater challenge for us to be able to meet demands for more ethnic foods during this time of the shelf-stable meals. Thank you.
Thanks. Mary or Jennifer, do you want to comment on that?
Sure. So, speaking from a cultural challenges perspective, the first thing that comes to mind for me is we operate a 62-bed Korean unit in our Laurelbrook location. And one of our biggest challenges existed in advanced directives for this population. As Laurelbrook became positive as a center and as any center, we very quickly reevaluate our advanced directives for each patient and have very serious conversations with each family member, and understanding the cultural way of the Korean population. There was no desire to have that conversation. So we had hospital providers very frustrated with us as folks returned to the hospital that we didn't have the answers that they were looking for. So that's one example. I think, as it relates to the pandemic and some challenges we've had.
Thank you all. So thank you to the panel. This is great. And I want to end on a feel-good note. And one of the things, yes, the importance of advanced directives, we're getting calls, and certainly regarding advanced directives, the importance of advanced directives and living wills. But one of the things that you're all saying, since the gyms are closed, we're outside. Of course, April was pretty miserable weather-wise, chilly, early mornings in the 30s, a lot of rain, cool days. So it hasn't been great to get out and jog or take a walk necessarily, and the parks are officially closed, although I think they're reopening tomorrow technically. But walking in the neighborhood, as we've probably all done, and one thing, it's so wonderful to see walking the families who are outside playing together, riding bikes together. First of all, we would be at work most likely, and we wouldn't necessarily see that, and they would be at work too. So people are opening their garages and, talking to each other from a distance. And it's great to see the community involvement, the teddy bears in the windows and everything else that walking in there, but it's nice to see, because in my neighborhood, it's just, close the garage door, boom, you're, never see each other. And it's nice to see that families are outside playing, having a catch, playing hopscotch. Remember, we all, the good old days with the colored chalk, etc. So it's just fantastic. And speaking of a feel-good moment, I had a good friend, Brett, from Cherry Hill, who developed COVID-19 early on in the pandemic by around middle of March. And he was on a ventilator at Cooper Hospital for a full 19 days. And thankfully, he was transferred from Cooper, and wherever he spent almost 3 weeks in the ICU, and then stepped down, and now he's in. Now he went to a rehabilitation hospital where he's continuing to recover. He's currently. So, what I wanted to show you what graduation looks like. My 2 daughters are supposed to graduate from college in New York. That, of course, will not happen in May. So this is our new normal. This is what I wanted to show you, and we probably have seen it. This is what graduation looks like from leaving the ICU unit after spending 19 days on a ventilator, and then we'll be back. It's just a minute video. Laura, let it. Come on back.
Just did that. Nursing home staff.
Hello? Do you hear me? Yeah, okay. So we have to work out the kinks with coming back and working on it. So by hopefully we're going to do this again sometime over the summer. By then we'll have the kinks worked out. But no matter what, it's just par for the course. We're you know, someone put this, basically we're building the plane as we are flying it. And I think that's an apt analogy, what we're all trying to accomplish right now, as you can see from our tech issues that we have had over the past hour and a half. So not a problem. It's all part of the territory, and you know, you go with the punches. So, and that's really what we've been doing is, you know, this is new to all of us. And so I thank you all for your time. You've been incredibly generous with your time and great information. So thank you all for sharing your personal experiences, your office experiences, your team's experience, because this is vitally important information for all of us. And the nice part of watching that video is for the most part, I would say 99.9%, as one of you said, it really shows the good side of humanity. It really shows that there's a future. It really shows that it's bringing out the best in people. There are some one-offs out there. We all, no matter what we do, there'll always be that. But the nice part is that video, that's of the new graduation, it's happening all over the country. And it really shows there is hope for the future. There's hope for humanity, because we're all going to come out of this stronger people. And it's whether it's a better parent, better child, a better manager, a better owner, a better lawyer, a better healthcare provider, a better CEO. So it's bringing out, it's showing the empathy that 99.9% of us have, and it's bringing out the best in people. So that said, thank you all for doing what you do. Thank you all our healthcare providers for helping Brett and everything you do every single day of the week, and everything we all do. So with that, I'm going to turn it back to Linda and say thank you all for participating. And Linda, it's all yours. And you can remove the video.
Thanks, Jerry, and thanks to our panelists. This was great. We did want to see if everybody wanted to just take a minute to share any closing thoughts. Laura, if you want to put up their screen and each one of you can weigh in very quickly.
Yes, I'd like to say that COVID has challenged us as an organization to do things differently, and we responded to that challenge. We've been caring for this community for 100 years, and we're especially astonished not only by every healthcare worker and everyone who's doing things differently out there, as Jerry had spoke of, but also our team of caring, competent, reliable, and compassionate people who dedicated their lives to caring for the patients in this community. And for that, Morristown VNA is very grateful. Thank you for having me.
Really appreciate the opportunity today. What I'd like to say is better days are ahead. Every day forward is one COVID day behind us. We appreciate the opportunity to continue to serve our communities. And what I would also add is reach out to your healthcare partners. We're okay and we're not okay. But now calls for as much support as possible and just reaching out to people. So thank you for the opportunity today. Really appreciate it.
Well, everyone, thank you very much for the opportunity to be with all of you today. I think as we all continue to really figure this out as we go along, the biggest lesson I've learned is that out of our 1,200 or so members at the Chamber, everyone is here to help each other, try to figure out how best to not just navigate the crisis, but help everyone. We have so many healthcare professionals, so many of you that tuned in today know me and know our organization and our active members, and I'm thankful for all of you. We have 120 nonprofits, and then we have so many regular members that are just reaching out day after day to our Chamber and saying, how can we help healthcare workers? How can we help those in most need? And Jerry touched on it, but it's very true. We're seeing the best come out of people in unique and different and creative ways that we've never seen before. So that has definitely been the most rewarding part of leading the Chamber through this time, is seeing how much our members all want to help each other through it. And we, of course, are here for all of our members to help them, whether it be with resources or connectivity, as we continue to navigate the crisis together. So again, thank you for having me. I appreciate it. And everyone, please stay well.
Hi. Hi, I just wanted to say thank you for the opportunity. A quote I've used quite a bit over the last month or so is that crisis doesn't create character, it reveals character. And not just as Ardis Senior Living, but every healthcare provider that we have come across and worked with. This industry is filled with a lot of people with a lot of amazing character. So to all our counterparts, we want to thank you. We say be well. We talk about when things go back to normal, and Jerry talked about it a little bit before. I hope some things don't go back to how they were. I hope that we have kids who engage with seniors as much going forward as they are doing now. I hope people wave to one another when they're on the street, and I hope that people who have a lot and are blessed help those who might need a little bit of help. So thank you, everybody. Keep up the great work, and we will all get through this together.
Sorry. So I just wanted to say how grateful I was to have the opportunity to represent Inspira Life today. I think I've watched us respond to this COVID crisis and seen that it really ignited, I think, some of the best qualities in my staff. It's driven adaptation and creativity. It's forged strength and bonds among our team members. And from here, we've all said we're not going to go back to the way things were. We're going to go back to a new normal. And it's going to be, I think, characterized by greater integration of technology, more efficient operations, and refocusing probably on what's really essential without being distracted by the things that are probably less important. And of all the lessons that I've learned, I think the most valuable one, the one that's going to remain after we've lost our face mask somewhere in a drawer, is a renewed sense of confidence in just the innate goodness and compassion and invincible resilience of all of us, of our families and our colleagues and our neighbors. And what's impressed me most as I watch this drama unfold is not so much the horror and the magnitude of the devastation, though that has certainly been awful, but rather the renewal of basic kindness and courtesy and appreciation for so many simple things I think we were taking for granted. And I really do believe, as so many of us have said today, that we're going to emerge from this crisis as better people, better parents, better healthcare workers, more grounded in what truly matters. And I hope we all stay well. And I thank you again for this opportunity. I do think it will be a better world ahead.
Thank you once again, Jill, and thank you once again to all our panelists. And I think, Doctor, I've received note, Dr. Luke is coming back on, is that correct?
Join you. So, yeah, I'm here. Thanks for, guys, I think
I don't see the video. I hear your voice, not the video, but that's good enough.
It's okay. Yeah, I'll wrap it up for you in 4 minutes or so here. What an awesome panel. First of all, guys, I'm in California. I can't begin to understand or fathom the emotions and the physical output that's taken place back in your region of the country over the last 6 weeks. We're in California. It was interesting to hear that you guys are opening parks, and today they're closing our beaches, and it's a different time, but we haven't experienced quite the emotion you all have. And I wanted to just give you a little bit of a preview of how the conversation and news cycle will continue evolve day to day, week to week, as we move towards the fall when we do get together, because I do think that nursing homes are going to be the media theme over the summer. And I almost stood and clapped a couple times with a couple of the panelists who are awesome. And Jennifer pointed this out a few times, but I want you guys to know I'm not only a hospital CEO of 10 years, but I'm a nursing home administrator by trade, and I did that first. And it's a really rare combination to find that experience. And so I've always been an advocate for all levels of post-acute care. In fact, I was one of the most vocal, outspoken, I don't know if critic's the right word, but people who said back in 2011 and 12, as I was speaking and writing books and founding the National Readmission Prevention Collaborative, I was one of the people saying non-medical home care has to be included in this conversation. It has to be part of it. Insurers have to start paying for it. And as you know, in 2018, Medicare Advantage in 2019 started paying for that, and now we can have a true conversation. And that was a very passionate campaign that I led across the country, and I wasn't the only leader. I'm not suggesting that, but it's something that I was consistent in saying as my mom battled Alzheimer's, and I saw it firsthand. What I want to share with you now is what Jennifer and some of the other panelists kept coming back to is the ungratefulness of the senior sector from the public's perspective. Is here's the good news. It's bringing light to the fact that that this is a long-term challenge that we face that nobody's been aware of. And to give you an example, and I'll say this just as I would in a hospital boardroom because I'm a hospital CEO by trade, the arrogance and the lack of attention to providing post-acute from the not-for-profit hospital sector is finally going to become an issue for good. For us to, I sat in boardrooms for years with people saying, shame on that nursing home, they're terrible, shame on this assisted living, when nobody in there lifted a finger, nobody in there provided resources, nobody made a phone call. And what you guys will get to know about me as I speak and as I present, part of the reason I think people want me to come back and do more education is because I come up with these one-liners that really have an impact. And let me give you a couple that I have been, just to finish that point. I always ask hospital executives, hey, you know that nursing home that you're talking about? How many times have you ever visited it in the 9 years you've worked here? I know it's really difficult to get there because it's so far away, like 600 feet in the parking lot, and you haven't set foot in it once. But it's points like that that I make, and I'm going to share with you a couple I shared with Fox News in an interview last week and KNX radio here in Southern California a couple days ago, as the story turns to nursing homes. In most nursing homes, there are less than 3 nurses on site providing patient care at any given time. At least that's the case in California. So I have always said when I speak, why do we call them nursing homes? Why don't we call them CNA homes? Because that's who's delivering the majority of the care. And I go on to explain to them that our nurses are so overwhelmed doing the med pass and documentation that that's almost their full-time job. And it's so prohibitive. And so these are the points I make to help people bring resources to you. I also point out that in most nursing homes, there's 3 or less, in most cases, 2 college degrees on the staff other than the nurses. And I do that to help people understand. And guys, remember, I'm one of you. I say that to get my point across so I can advocate, because I am one of those 2 college degrees, which is the administrator, right? I'm just making the point that most of these are people employees or people with a heart for caring, that love their residents. I have a whole presentation about how I learned as an administrator that every single person there loves their residents. And now the national spotlight is going to turn to that. Stop pointing your finger and saying shame on you at senior communities, and ask why these not-for-profit hospitals whose CEOs are making $8 million a year, $2 million, $4 million a year, and are required by law. You may not know this. Nursing homes are required by law to do a community needs assessment every 3 years and to allocate budget to it and to report back on how they're doing. Why aren't you part of that community needs assessment? I'm going to challenge you right now to identify, and they're online, just Google it, your local not-for-profit hospital, community needs assessment. Ask for a copy of their community needs assessment, find out who writes it, and make sure your nursing home, your assisted living, and all the others in the community are included in it when they start to rewrite it. So I'm going to just wrap up on that.
Yeah, we're going to have to finish up. I thank you for this important information. We're going far into OT, so we need to wrap it up, and I'm going to have to bring Linda back on.
Thank you.
Okay, thank you so much for the insights. We look forward to hearing from you in the future.
Likewise.
Yes. Thank you, Dr. Luke. Thank you, Jerry. Thank you to all of our panelists. This was a great experience. As you can see, we're planning to do this again. As Jerry said, we're going to work out the kinks, and which were few and far between, I think. I think we did pretty great. Kudos to Laura and the behind the scenes team. The next panel will be June 4th. We will be opening up registration very soon, so keep an eye out for that. And also look at rothkopflaw.com to see about any of our other great educational seminars and the virtual meeting of the minds. There's an awful lot that's going on, and we would love to have all of you get involved with us. And with that, we'd like to say thank you. Again, thank you to all of our sponsors. We appreciate all all their support, and to you, thank you. As Jerry said, this way you didn't have to schlep through the windy weather and the rain. We're glad we were able to spend some time together, and thanks. Have a great day, and be sure to follow us on social media, our Facebook, our Twitter, our LinkedIn. We are glad you are here, and thanks, and have a great day.